Good evening, everybody. Thank you so much for inviting us from Public Health to come and speak to you today. We're going to speak to you about messages to support residents live a longer and healthier life, which I'm sure is a subject close to everyone's heart. What we wanted to do, RF has asked us very kindly to set out what the key challenges are for health in the borough. We wanted to say that life expectancy, overall lives are cut short in Tower Hamlets, with adults living shorter lives than elsewhere in London and England. We have poor health and a higher rate of long-term conditions. So by long-term conditions, we mean higher rates of diabetes, lung disease, and heart disease. For type 2 diabetes, shockingly, Tower Hamlets has double the rates of type 2 diabetes for people under 40 years compared to England. That's a huge number of people who are at risk of a long-term condition that can cause tremendous complications. Over half of those with type 2 diabetes are between 40 and 60 years. That's relatively young. So for lung disease, men from all ethnic groups are at risk. Half of those affected are between 50 and 75 years. For heart disease, men, especially Bangladeshi men, and white men are most at risk. In the UK, 1 in 8 men, so 1 in 8 of us in this room, and 1 in 14 women die from heart disease. And lastly, high blood pressure. Around 50% of all heart attacks and strokes are associated with high blood pressure. It is the silent killer. You are more likely to be at risk of high blood pressure as you get older, and if you're from a Bangladeshi or a black ethnic minority background. Around 30%, so 1 in 3 of us, is going to have high blood pressure. So those are all, I think, shocking statistics and cause for us to work together, I think, to try and address this in our borough. So in terms of the health conditions affecting residents, the main causes of death in our borough are cancers, heart disease, and lung disease. And the most common long-term conditions are type 2 diabetes and high blood pressure. So these are the things we're grappling with. So what's causing these high rates of long-term conditions? So these are the 5 risk factors which are driving this picture that we can see. The first is obesity, so when we're overweight. The second is smoking. The third is blood pressure, high blood pressure. The fourth is alcohol intake. And the last is mental health. And some of the other factors that sit around these vital 5, as we call them, are things like our financial stress, our housing stress, our employment stress. And that all feeds into our mental health, which in turn shapes our physiological responses and creates some of these other more physical health conditions. So mental health, although we're not going to talk about it today, is extremely important. It's on what we call the pathway to the acquisition of other long-term conditions. Right, so there we are. That's the picture. We are now going to talk about the health messages, and my colleague Vignesh is going to give you the kind of health messages that we're hoping you could communicate with your congregations and with your residents. And at the end, we're going to ask you to think about the messages that we're giving and try and perhaps work with us to adapt them so that they're better suited to the environments in which you've got to give these messages out, because we're hoping that you will help us. So over to you, Vignesh.
Thanks, Steph. So as Steph mentioned, one of the main things is around obesity and being overweight. So a key thing is maintaining a healthy weight. And one of the things that we have both nationally and locally is weight management services. So you can find weight management services in the borough, for example, by scanning the QR code, and also coming to speak to us afterwards about what local weight management services they are. And then in terms of quitting smoking, so there's a number of different ways that you can quit smoking, and it's never too late to quit smoking. So even if you've smoked the whole of your life, it's never too late. And one of the things is attending a local pharmacy that provides smoking services in the borough, and also speaking to our specialist support service, Quit Right, in Tower Hamlets, which provides specialist advice and support around quitting smoking, as well as different culturally sensitive information as well. And then in terms of getting checked for high blood pressure, so if you're over the age of 40 years old, you can walk into most pharmacies in the borough and get a free blood pressure check. There are also free NHS checks for people aged between 40 to 74 years old. So how this happens is that GPs routinely call you every 5 years. If you haven't been called in the last 5 years, then I would really advise you to speak to your GP about accessing a free NHS health check. And then vaccinations. So especially for people over the age of 75 years old, and those with specifically weakened immune systems, you can access the COVID vaccination booster for spring from walking into any pharmacy or by booking through your GP. And we have a script on our table around how you can promote the vaccine during Friday prayers. And then I just wanted to speak about MMR. So measles is an infectious condition that affects children. And what we've noticed recently is that in London especially, measles cases are on the rise. So why this is important is that it can lead to hospitalization of young children. So one of the things that you could do is, if children are not vaccinated for MMR, then please speak to your GP. So in terms of the vaccine, there are 2 vaccines. One of them, which is known as the Pyrex, does not contain any gelatin or pork in them, and it's completely suitable. So if you still have questions around this, I would strongly advise speaking to a GP and really promoting this, as some of the cases are on the rise in London for measles. And just going to give it back to Steph.
And lastly, you've heard about the messages that we've had. We've given you 3 key messages there and some messages on vaccination. But we really need your help to make sure that we're hitting the right spot with these messages. So what we'd really like you to do is tell us how these messages could be made better, and you could help us customize them a little bit. We're looking for your ideas, and we're also looking for you to volunteer and help us, maybe have a meeting with us to try and make these messages as good as they can be. Because without these messages, I think we're going to have this situation for our children and in the future. And we kind of need to take action now as a population. We're concerned, we know that you're concerned. Everybody wants to do something. So with these key messages, we can make a difference. So please come to our stall after the event is finished. And do come and write your ideas on some post-it notes. We have some here. And we've also, as Viknesh said, got some leaflets for you to take away. So thank you so much for your attention. And please do join with us as we try and support the borough to address long-term conditions. Thank you.